Alright, my presentation is over the link between Benadryl and dementia. The use of Benadryl alongside diagnoses of dementia is becoming prevalent in social media and news, leading people to develop conspiracies and spread misinformation, overall just creating mass hysteria. To give an overview, dementia is a disease often found in older people. It usually causes a major decline in cognitive function. There's many types of dementia, but they really all share the common symptoms of confusion, difficulty remembering, and losing the ability to comprehend. So this is a chart that I got from the Alzheimer's Association. Shows the progression of the disease. So Alzheimer's is a brain disease and leads to dementia. It's thought because where neurons aren't functioning properly and they aren't able to send in messages clearly through the nervous system. One of the neurotransmitters responsible for this is acetylcholine. So to give you some insight into how neurons work, if you don't know, there's these synaptic knobs. This is going to be the presynaptic knob. This is the postsynaptic knob. Here's your synaptic cleft. You have either electrical or chemical signals. With a neurotransmitter, it's chemical. So it's going to pass through here, sit in this synaptic cleft, either get reuptake, or it's going to pass all the way through. So people with Alzheimer's, they lack the neurotransmitter acetylcholine. So when there's not, lack of neurotransmitter, there's not going to be much signal going on between the neurons. This leads to decline in cognitive function, memory, issues learning, and as it progresses, it starts to interfere with your daily activities. And this is where treatment and relief from these symptoms can be hindered, and it's by the use of Benadryl, which I will go over in the next slide. Alright, to give an overview on Benadryl, it's an antihistamine, anticholinergic, which is important for what I'm about to talk about. It reduces the release of histamine, so when you have an allergic reaction, you flare up inflammation, calms that down. It's used for allergies, common cold, also fever, and it's available over the counter. It's also called, the generic name for it is diphenhydramine, but it goes by the brand name Benadryl. And this is what the package looks like. Like I said, it's over the counter, so you can go to Walgreens or Walmart, wherever it may be, and just pick some up whenever you have allergies, allergic reaction. Alright, to further on the anticholinergic part. So, anticholinergic means it blocks the acetylcholine that we talked about in the last slide. So, like I drew, you have these synapses, and then you have the synaptic cleft. So when it blocks the acetylcholine, people with Alzheimer's and dementia already lack that. So blocking it is going to make for even more symptomatic patients. There's not going to be much signal going on here. On a study and analysis that I researched, the author goes into how antihistamines work on a neurological level. He focuses on how the neurotransmitters interact in the brain, and because of the way that these signals work, Benadryl is probably not the best option for those susceptible to dementia. The typical dosage for an adult is between 25 to 50 milligrams, not exceeding 300 per day. And with older adults, they may not follow the specific dosing guidelines, especially if they're having trouble sleeping or really wanting to ease their allergy symptoms. They may overlook the instructions, and taking more than the maximum dose can lead to seizures, hallucinations, extreme agitation, And some of these side effects mimic the same side effects of dementia. So that overlap may have been misinterpreted as one causes another. So that may lead some to assume that there's a direct link. Benadryl doesn't necessarily cause the disease, just same symptoms. And so really this highlights the importance of just not jumping to conclusions and just doing research on it. Studies conducted by Taylor, Rowan, and last name Gray found a connection between Benadryl and the development of dementia. But one of the main issues they pointed out was without strong evidence, it's hard to draw conclusions. But not all researchers agree. Robbins, for example, came across a study that favored the potential link. And in this study, both over-the-counter drugs like Benadryl and prescription medications like benzodiazepines were analyzed. These are both depressants. That's why they chose them. So these drugs aren't officially labeled as sleep aids. Benzodiazepines are mostly used for anxiety or seizures, and Benadryl is obviously just used for allergies. And the study focused on a large group of participants 65 and older over an 8-year period starting in 2011. Excluded anybody before they started the study. They excluded anybody who had already had signs or symptoms of dementia, so they wouldn't have any sort of bias. By the end of the study, they concluded that people who use these medications regularly had about a 30% high risk of developing dementia over time. And while that doesn't directly prove that there's a direct cause and effect relationship between the two, it definitely raises concerns to proceed in studies and more research on the issue. Okay, this is just a chart I pulled up from the Alzheimer's Association. Basically just shows a progression, or I guess the projection of cases and people affected up until 2060, so just a future reference. Okay, so when you're looking at long-term solutions for insomnia, this is, just relating to if older adults were to take Benadryl because they have insomnia. This is basically just kind of looking at other options for that. In a study I researched, it was really just an analysis article, but his points were really just cognitive behavioral therapy, or CBT, as the most effective treatment. So, unlike medications that have side effects, can cause adverse reactions, especially in older patients that already have a lot of other medications they have to take, with other diagnoses they have. This is definitely the way to go, because you don't want to start them on a set of medications for insomnia if it's going to have reactions with their other medication. So would definitely look at therapy for this. Involves helping people change the way they think about sleep and really setting up their sleep schedule and having better habits. It may include identifying different thought patterns, especially, when you have insomnia, it may be related to anxiety. Can't sleep because you have anxiety, stuff like that. So it also pinpoint those issues and help you with those issues. Over time, therapy definitely works better than medications. Medications aren't a cure-all. Definitely a combination of both can work. But it's really just the severe cases, as what I read from an article, that they take medication and therapy. But commonly prescribed options, if you are going that route, would be antipsychotics, antidepressants. Like I said, you just have to pinpoint what is causing that insomnia and address that first. Address the root cause, really. Even though the evidence linking Benadryl and dementia is limited, it's important to, especially with older individuals, just proceed with caution. Just because the risk isn't fully proven doesn't mean it shouldn't be ignored. Okay, so like I said about the therapy and medication, doing those simultaneously for treatment of insomnia, I'm going to be going over these different diagnoses and medications to treat those diagnoses that would be beneficial for older adults to know before taking the medication. Basically just going over the effects of, if they were taking, antipsychotic, antidepressant, things like that with Benadryl, what would happen. So what I have here, I have these pulled up. This is risperidone, haloperidol, and quetiapine. And if you take those with Benadryl, it's probably going to make you pretty drowsy. Here I have fluoxetine, escitalopram, and sertraline. These are generic names for antidepressants. If a patient has depression and they're also taking Benadryl, they might, I wouldn't say always, have impairment, but definitely drowsiness and maybe some confusion. Okay, so this is Dawn's pill. I put the structure beside it. I also put the structures on all the other slides, but anyways. So if you did take this with Benadryl, it's going to have the opposite effects. It's kind of like taking a stimulant and a depressant at the same time. They're basically just going to cancel out. Both those medications are going to be ineffective for the patient. Okay, so this is a picture of the AGS Beers list. So it's by the American Geriatric Society, and it's a guide created to help doctors identify medications that may be risky when prescribing to patients 65 and older. It highlights medications that may be dangerous, whether or not they're taking other medications that would have adverse effects. Just in general, even if they aren't prescribed any other medications, which is rare, but really the goal of the Beers list is to help doctors make safer decisions. So I thought I would point it out here. I think it's a pretty cool thing. Basically, this is just a little sample, but it has like list upon list of medications, why you should avoid them, what diagnoses are associated with them. It's very cool, very cool. I would definitely check it out. Alrighty, so alternatives. Many articles recommend avoiding the use of Benadryl, and so I am going to put some alternatives here for these older patients. allergy medications, alternatives to Benadryl would be prescribed over-the-counter, nasal, or oral corticosteroids and decongestants. These are things like, I wouldn't say pseudoephedrine, but things of that nature, things that are in Zyrtec, just not diphenhydramine specifically. Insomnia medications, these can be prescribed or non-prescribed, benzodiazepines and over-the-counter melatonin. Really just depends on the preliminary diagnosis, preliminary medications to determine if these medications will work with the patient on addressing their allergy and insomnia needs. These minor changes could really just solve the severity of episodes and really make sure that there are concise diagnoses, concise treatment, really looking for the best way to help these people.